Back pain. What is back pain? It is the most common problem. It is frequently resulted from the strain of normal muscle, ligament or tendon and not from the critical issue. So, how is the back structure? The spine or the backbone is one of the strongest parts of the body and gives us the great deal of flexibility and strength. So, it consists of 24 irregular bones, vertebrae that sit on the top of others separated by in between these inside the heart vertebra. The spinal cord travels well protected, bridging the communication from the brain to the rest of the body and aided by the nervous system. But did you know what are the most common causes of back pain? So for the first one, it is because of slouch from texting or reading, rounding your spine when you pick things up or bending down, and the last one is excessive sitting, especially in a poor posture.
How can stroke caregiver got back pain? Stroke survivor may continue to have some form of physical disability after they are discharged from hospital. Thus, they may require assistance to get off bed and to sit on a chair. Because of this, the caregiver may develop back pain as they are always transfer the stroke patient from one place to another and do heavy tasks. This may be because of they do not have the knowledge about the correct technique to handle the stroke patient and the technique to transfer lifting. In this video, we are going to share a few exercises to treat back pain and the correct technique to transfer stroke patient. Lie on your back with your knee bent and your feet flat on the floor. Then bring both of your knees to your chest and hold it for at least 15 to 30 seconds. And then relax, lower the knee to the starting position.
The position of comfort on all four with your wrist, elbow and shoulders tucked as uneven hips. So you are going to push your bottom back as close to your heels as you can comfortably get it. At the same time, you are going to slide your hands ahead of you as far as you can and tuck your head under. Hold this here for 15 to 30 seconds and then slowly return to starting position.
Stand up straight and place both of your hands on your hip and then bend backward as far as possible and make sure to keep your knees straight. Hold in these positions for 2 seconds and then return to the starting position.
Lie down on your stomach with facing the floor and both of the hands on the floor under your shoulder. Slowly push your upper body up with your arms and move your neck upward and then hold it for 15 to 30 seconds and then return to the starting position.
Lie down on your left side on a mat or the floor. Your body should be in a straight line with your leg extended and feet stacked on top on each other. Then, bend your elbow and cradle your head for support. As you exhale, gently raise your right leg off the lower leg. Inhale and lower the leg back down to meet the left leg. Repeat this exercise to 10 to 12 times, then switch to the other side.
To start, lie on your back with your knee bent and feet flat on the floor. Don't press your neck or lower back to the floor. And then you should cross your arm loosely and take a breath deeply. You should feel comfortable and relaxed in this position. And then you need to curl halfway up and keeping your head in line with your shoulder. Repeat this exercise for 10 times.
There are risks involved when transferring loved one that can result in injury to you. The most frequent transfer-related injuries in caregiver are back pain, broken rib, herniation, and rotator cuff injuries. You need to preparing yourself before transfer patient. First is keep the person close to your body. Second, keep your feet shoulder wide apart to maintain balance.
Is prepare wheelchair. Place the wheelchair at 45-degree angle to the bed. Position wheelchair toward your strong side and secure the brake. So the first position is sitting up in bed. Make sure to keep your head and neck in proper alignment with your spine. Lift patient arm to shoulder level and left hand on the stomach. Cross patient left leg over the right and turn to the side. Lower both legs toward the floor and hold shoulder blade and left hip. Remember to make sure that carrier's back is straight and stomach muscle contracted when lifting and transferring the patient. Seat the patient over the edge of the bed, support patient left knee, and move it forward until leg has reached the floor. Second position is standing up. Both patient hand on the carrier's shoulder. You have to use the muscle in your leg to lift or pull. Quads and glutes to measure muscle group that help you leverage yourself and lift something. Bring the patient body forward, hold pants and support the knee, and ask them to standing. The last position is sitting down. Turn the patient toward the wheelchair while support the knee. Lastly, bend patient body slightly forward and sit her. Last but not least, when carrying a person, you must pivot or take small step and avoid twisting at your waist.